Good evening, ladies and gentlemen. Today I'm going to presenting the case study of subject clinical practice mental health, NBCP 3912, Bachelor of Medical and Health Science, January intake 2023. First of all, I would like to introduce myself. My name is Muhammad Nur Iqbal bin Muhammad Saad. I am from Kota Kinabalu Learning Center. The patient care and management of a patient with schizophrenia. The introduction. Schizophrenia is a complex disorder with a wide range of symptoms. Schizophrenia symptoms can be categorized as positive, negative, or cognitive. However, they are not exclusive. Positive symptoms are typically absenteeism, such as chronic insanity, which is characterized by a lack of fact interaction and include paranoia, hallucination, and abnormal expression and behavior. This is a citation from Dodgeman S. 2008. The National Survey of Health and Mobility, Ministry of Health in Malaysia, showed that the prevalence of mental health disorder among people aged 16 and above is 29.2%, or around 4.2 million. This figure shows that 1 in 3 Malaysians experience mental health issues. The result indicates a double increase of 10.6% in 1999 and 11.2% in 2006 for occurrences related to mental health disorder, which raises serious concern about the new illness. Mentally ill individuals may experience negative side effects and seem to exhibit suicidal behavior. It is necessary to provide them with appropriate assistance and direction. Presentation of the case. This case was taken from Hospital Mesra Bukit Padang. Demographic data. Patient is male, 45 years old, Dusun, and presented with third admission of patient to Hospital Mesra Bukit Padang. The last time a patient was admitted to Hospital Mesra Bukit Padang was on 10 May 2022 and discharged on 20 of June 2022. Okay, this is the sequence of the patient history before the admission. The third week before the incident, in the third week, patient started having intermittent auditory hallucination, especially when they were sleeping. Patient report hearing a variety of voice, both male and female. The sufferer heard the voice asking them to do something terrible, which is the sufferer can still shout out the voice. True, the patient did not want anyone to notice that he was taking medication. Thus, the patient's wife claimed that only he was in charge of monitoring it. The patient is concerned about not taking the prescribed medication as directed. No one dared to correct the patient at the point because family members fear the patient might act more violently. The patient's emotion got irritated. To support his wife and family financially, he ventured out more frequently in search of employment. The patient claimed that the medication was uncomfortable since it gave him a headache and make him feel lightheaded. On the second week before the incident, patients start to disregard requirement for biological necessities, including hygiene and personal hygiene. His daily routine gradually shifted, and patient occasionally skipped the evening shower while wearing constantly damaged clothes. The patient looked deteriorate to an unmanageable state. On occasions, the patient is seen taking, talking to himself with no one in front of him. Due to hearing the voice frequently, the patient get unpleasant and verbally abused, which lower their mood. At the time, the patient was less talkative and less friendly. Additionally, the patient appetite declined and their eating habit become irritated. Occasionally eat, sporadically not. Although frequently late, patient can nevertheless sleep normally. And the first week before the incident, patient hear the voice more often, almost most of the time. The voice told him to do something bad, occasionally telling him to commit suicide. The patient's sleep become more disturbed because he often hear the voice and he tried to ignore it. The patient also stated he became more depressed due to auditory hallucination disorder. The patient emotionally become angry. Sometimes he will vent his anger by throwing things at home and even scold anyone if he is not satisfied. On the day of the incident, on the morning of the incident, the patient displayed a high level of aggression and injured his wife by punching her in her face. The patient was awake by the voice urging him to strike his sleeping wife, and patient has also broken property in the home by hurling whatever he could reach against the wall. His wife discovered a knife hidden under the patient's pillow, and she was making the patient's bed, which is paranoid delusion. The patient's wife called the nearest police station to request assistance because the condition at the time was challenging to manage. The patient was brought to Klinik Kesihatan Putatan after the police arrived at her residence and subsequently referred to Hospital Mesra Bukit Padang for admission in the ward for treating the safety of himself and other family members. Okay, on the side of family history, the patient is number 7 of 7 siblings, and the father was died of age in 70 years old. And apart from that, family history of mental illness. Patient has also has a history of mental illness of the father side of the family. And family socio-economy. The patient family socio-economic situation is average. Before being married, the patient used to live longer with his sister at Kampong Dovanson. And occupational history, the patient began working upon completion at Form 5. At the time, he was looking for a job around where he resided. Patient have performed a variety of tasks, most of which are brief. And social history, after graduating from the high school, or when he began working in a factory close to his home, the patient started smoking and drink alcohol. On a physical examination and laboratory investigation, the lungs was clear, and at the front of the patient got 2 scars of a lateral aspect of the left thigh, and the other side is normal. And the vital sign examination, the blood pressure 125 over 82, which is normal. The pulse 77 over 1 minute. Respiration rate is about 22 per minute, which is normal. The temperature 26.9. The height and body weight is 170 and 88 kilo. The BMI is quietly obese. On the laboratory result, the others is normal, but the others is normal, which is quite okay lah. Assessment have been done on this patient, which is include general appearance. The finding, he wear a white, clean, and tidy shirt, short and bald hair, fat and tall, black skin, and normal in term of hygiene. No problem in term of hygiene. And the assessment on behavior, the eye contact is good and it's very comforting, normal gait, normal walk, and attentions and concentration is fair. And he also cooperative, no restlessness or bigotry, protruding mouth, rabbit mouth syndrome have been seen to this on this patient, and grinding teeth at the time. Clench his teeth. Assessment of the speech, he speech of spontaneous speak, coherent and relevant, normal tone, volume, and the rate and speed, and speak in Malay language. And assessment in emotion, he is in the euthemic mood and the effect is appropriately. On the assessment on perceptual disturbance, patients do not experience any perceptual disturbance. And the assessment on true content, he said that one of his friend owed 600 from him, Mr. Jamali, who worked at Jabatan Kerja Raya. The patients claim that Jamali has requested his permission to spend the night at his home. If permitted, Jamali will pay off the outstanding loan. Because he believed Jamali had malicious intents toward them and their family, the patient turned down the offer. No intention to harm others or have suicide through. The patient management plan in the hospital or the ward in hospital Mesra Bukit Padang, he was treated in pharmacotherapy drugs, which is he got 4 drug, tablet haloperidol, 5 mg on night, and the side effect, he got some drowsiness, dizziness, and blurry vision, and a bit sedation. And I am Modicate, 50 milligram monthly. There is no side effect reported to this patient, and he also on tablet simvastatin to high level of cholesterol to 20 milligram on night. And the last but not least, he take tablet benzicol, or the brand name should be called Atin. This is anticholinergic or anti-Parkinson by oral administration. On the side of pharmacological treatment, the patient have been treated in pharmacotherapy, cognitive behavior therapy, or CBT, coping skill, and relaxation therapy. The pharmacotherapy was given to the patient and the family members due to counseling to make the family members aware about the patient's condition, and also the individual counseling have been done to know any issues that he had. And the cognitive behavior therapy to establish interpersonal connection during therapy to help patient to think more clearly. This is done to help patient understand how their negative through relate to the emotional changes they are going through. And the coping skill have been given also. The therapists that this therapy that instruct the patient on how to avoid situation that can make him getting worse and worse. And finally, the relaxation therapy have been also done to this patient, and he was teach about the proper technique of breathing. And as a result, this is to make this the patient respiration slower down. Okay, the blood pressure drop, the heart rate slow, and release the stress and the anger, and the mind become peaceful. Thank you so much for the presentation. Thank you.